According to the staff at the Mayo Clinic, there are 10 ways to control high blood pressure without the use of medication. And by making these 10 lifestyle changes, you could lower your blood pressure and reduce your risk of heart disease. My name's Kevin Carlson, and we're going to talk about this today on Generation Jones. If you have high blood pressure, medication might be necessary to bring the numbers down. But lifestyle also plays a vital role in treating high blood pressure. Controlling blood pressure with a healthy lifestyle might prevent, delay, or even reduce the need for medication. But first, here's the disclaimer: I am not a doctor, and the information on this YouTube channel should not be taken as medical advice. Please always consult your doctor for personal medical needs. Well, here are 10 lifestyle changes that, according to Mayo Clinic, could lower your blood pressure and keep it down. The first, lose extra pounds and watch your waistline. Blood pressure often increases as weight increases. Being overweight also can cause disrupted breathing while you sleep, and that's called sleep apnea, which further can raise your blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. If you're overweight or have obesity, losing even a small amount of weight can help reduce your blood pressure. Carrying around too much weight around the waist could increase the risk of high blood pressure. Number 2 is exercise regularly. Regular physical activity can lower your blood pressure. It's important to keep exercising to keep blood pressure from rising again. As a general goal, aim for at least 30 minutes of moderate physical activity every day. Exercise can also help keep elevated blood sugar from turning into high blood pressure or hypertension. For those who have hypertension, regular physical activity can bring blood pressure down to safer levels. Some examples of aerobic exercise that can help lower blood pressure include walking, jogging, cycling, swimming, or even dancing. Another possibility is high-intensity interval training. This type of training involves alternating short bursts of intense activity with periods of lighter activity. Strength training also can help reduce blood pressure. Aim to include strength training exercises at least 2 days a week. As always, talk to a healthcare provider about developing an exercise program. Number 3 is eat a healthy diet. Eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products, and low in saturated fat and cholesterol can lower your blood pressure. Examples of eating plans that can help control blood pressure are the dietary approaches to stop hypertension, known as the DASH diet, and the Mediterranean diet. Potassium in the diet can lessen the effects of salt or sodium on blood pressure. The best sources of potassium are foods such as fruits and vegetables, rather than supplements. Aim for 3,500 to 5,000 milligrams a day. As always, ask your healthcare provider how much potassium you should have. Number 4, reduce salt or sodium in your diet. Even a small reduction of sodium in the diet can improve heart health and reduce high blood pressure. To reduce sodium in the diet, read the food labels. Look for low-sodium versions of food and beverages. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. Don't add salt. Use herbs or spices to flavor food. And cook at home. Cooking lets you control the amount of sodium in your food. Number 5, limit alcohol. Limiting alcohol to less than 1 drink a day for women or 2 drinks a day for men can help lower blood pressure. Drinking too much alcohol can raise blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. Number 6, quit smoking. Smoking increases blood pressure. Stopping smoking helps lower blood pressure. It can also reduce the risk of heart disease and improve your overall health, possibly leading to a longer life. Number 7, get a good night's sleep. Poor sleep quality, getting fewer than 6 hours of sleep every night for several weeks, can contribute to hypertension. A number of issues can disrupt sleep, including sleep apnea, restless leg syndrome, and general sleeplessness, called insomnia. Let your healthcare provider know if you often have trouble sleeping. Finding and treating the cause can help improve sleep. Number 8, reduce stress. Long-term or chronic emotional stress can contribute to high blood pressure. It's important to determine what causes stress, such as work, family, finances, or illness, and find ways to reduce stress. Here are some tips that might help alleviate your stress level. Avoid trying to do too much. Plan your day and focus on priorities. Learn to say no and allow enough time to get done what needs to be done. Focus on issues you can control and make plans to solve them. For an issue at work, talk to a supervisor. For conflict with kids or a spouse, find ways to resolve it. Avoid stress triggers. For example, if rush hour traffic causes stress, try to travel at a different time or take public transportation. And avoid people who cause stress if possible. Make time to relax. Take time each day to sit quietly and breathe deeply. Make time for enjoyable activities or hobbies, such as taking a walk, cooking, or even volunteering. And practice gratitude. Expressing gratitude to others can help reduce stress. Number 9, monitor your blood pressure at home and get regular checkups. Home monitoring can help you keep tabs on your blood pressure. It can make certain your medications and lifestyle changes are working. Home blood pressure monitors are available widely and without prescription. Talk to a healthcare provider about home monitoring before you get started. Regular visits to a health provider are also key to controlling your high blood pressure. If your high blood pressure is well controlled, ask your doctor how often you need to check it. You might be able to check it only once a day or less often. And number 10, get support. Support of family and friends are important to good health. They may encourage you to take care of yourself, drive you to a healthcare provider's office, or start an exercise program with you to keep your blood pressure low. If you find you need support beyond your family and friends, consider joining a support group. This may put you in touch with people who can give you an emotional or morale boost and who can offer practical tips to cope with your condition. Again, if you suspect you're having high blood pressure issues, don't put off seeing your doctor. It's important to get it under control before it starts affecting your body. Thanks so much for watching Generation Jones. If this information has been helpful, please consider subscribing to the channel and click the like button down below the screen. We'll be back again in a couple of days. I hope to see you then.